Question 1. A patient presents to the emergency department after falling off a ladder and sustaining a displaced, comminuted fracture of the shaft of the right tibia. What is the most appropriate initial ICD-10 CM code for this condition? A. S82.221A. B. S82.222A. C. S82.229A. D. S82.291A. Answer: A. S82.221A. This question tests understanding of ICD-10 CM fracture coding, specifically laterality. The keyword right tibia is crucial for selecting the correct seventh character for laterality. Code S82.221A represents a displaced comminuted fracture of the shaft of the right tibia, initial encounter for a closed fracture, accurately reflecting the information provided in the scenario. Always pay close attention to details like right versus left and the initial, subsequent, or sequela encounter indicators. Here's an easy way to remember: precision in laterality, right/left, and encounter type, initial/subsequent, is key in fracture coding. Question 2. A 65-year-old male receives an influenza vaccine during an office visit for a chronic condition. The physician provides counseling specific to his chronic condition and then administers the vaccine. Which CPT modifier would be appropriate to append to the E/M code? A. -59. B. -25. C. -76. D. -51. Answer: B. -25. This question evaluates the proper application of CPT modifiers, specifically when an E/M service is performed on the same day as a minor procedure or vaccination. The keyword significant, separately identifiable E/M service indicates that the E/M service, counseling for the chronic condition, was distinct from the vaccine administration. Modifier -25 is correctly appended to the E/M code to indicate that a significant, separately identifiable evaluation and management service was performed by the same physician on the same day as another procedure or service. Always remember to use modifier -25 when a patient has an E/M service for one issue and then a minor procedure for a different, distinct issue during the same visit. Question 3. What is the primary purpose of HCPCS Level 2 codes? A. To report inpatient hospital procedures. B. To describe physician services and procedures. C. To report services, equipment, and supplies not covered by CPT codes. D. To classify diagnoses and health conditions. Answer: C. To report services, equipment, and supplies not covered by CPT codes. This question assesses knowledge of the purpose and scope of HCPCS Level 2 codes. The keyword primary purpose directs you to the main function of this code set. HCPCS Level 2 codes are used to report medical products, supplies, and services that are not found in the CCPT code set, such as durable medical equipment, ambulance services, and certain drugs. For example, when an oxygen tank or a specific type of wound dressing is provided to a patient, a HCPCS Level 2 code would be used for billing. Remember, if it's not a CPT procedure and it's a supply or non-physician service, it's likely a HCPCS Level 2 code. Question 4. A patient is diagnosed with a malignant neoplasm of the lower lobe, right lung, primary site. What is the correct ICD-10 CM code for this condition? A. C34.31. B. C34.32. C. C34.11. D. C34.2. Answer: A. C34.31. This question tests understanding of ICD-10 CM neoplasm coding, specifically for lung cancer. The keywords malignant neoplasm, lower lobe, and right lung, primary site are all crucial for selecting the precise code. Code C34.31 specifically identifies a malignant neoplasm of the lower lobe of the right bronchus or lung, which matches all aspects of the diagnosis. Always ensure you capture the site, laterality, and specific lobe or portion of the organ when coding neoplasms. When coding neoplasms, pay close attention to the specific location and whether it's primary, secondary, or in situ, as these details drive code selection. Question 5. In the context of hospital inpatient reimbursement, what is the primary purpose of diagnostic-related groups, DRGs? A. To classify outpatient services for payment. B. To group inpatient cases with similar clinical characteristics and resource utilization. C. To determine physician fee schedule payments. D. To identify quality of care metrics for hospital reporting. Answer: B. To group inpatient cases with similar clinical characteristics and resource utilization. This question assesses knowledge of inpatient reimbursement methodologies, specifically DRGs. The keyword hospital inpatient reimbursement points directly to the function of DRGs. DRGs classify inpatient stays into groups that are clinically similar and require comparable hospital resources, serving as the basis for fixed payments from Medicare to hospitals for inpatient services. For example, two patients admitted for pneumonia who have similar underlying conditions might be grouped into the same DRG, leading to a predetermined payment for the hospital stay regardless of the actual length of stay or resources used beyond a certain threshold. Understanding DRGs helps coders appreciate how their work impacts hospital revenue. Question 6. A physician documents unspecified abdominal pain. What is the most appropriate ICD-10-CM code? A. R10.0 B. R10.10 C. R10.9 D. K59.00 Answer: C. R10.9. This question focuses on coding symptoms and signs in ICD-10-CM. The keyword unspecified abdominal pain clearly indicates that no further detail regarding the type or location of the pain is provided. R10.9 is the correct code for unspecified abdominal pain, used when the documentation does not specify the type of pain, e.g., localized, generalized, acute, chronic, or its specific quadrant. When documentation is vague, coders must use the unspecified code, but it's always best practice to query the provider for more specific information if possible to ensure the highest level of specificity. Remember, if it's not specified, use the unspecified code, but always aim for more detail if the documentation allows. Question 7. What does the medical term nephritis refer to? A. Inflammation of the liver. B. Inflammation of the kidneys. C. Inflammation of the nerves. D. Inflammation of the joints. Answer: B. Inflammation of the kidneys. This question tests basic medical terminology, specifically the meaning of a common medical suffix and root. The prefix nephr- refers to the kidney, and the suffix itis indicates inflammation. Therefore, nephritis literally means inflammation of the kidneys. For example, a patient diagnosed with acute nephritis would have sudden inflammation affecting their kidneys. Knowing common prefixes, suffixes, and root words can unlock the meaning of many medical terms, making coding and understanding clinical documentation much easier. Question 8. Under HIPAA, what does PHI stand for? A. Patient health information. B. Protected health insurance. C. Public health initiative. D. Patient healthcare identifier. Answer: A. Patient health information. This question assesses knowledge of foundational healthcare regulations, specifically HIPAA. The abbreviation PHI is a key term in healthcare compliance. PHI refers to any information about health status, provision of healthcare, or payment for healthcare that is created or received by a covered entity and can be linked to a specific individual. For example, a patient's diagnosis, medical record number, and even their name are all considered PHI and must be safeguarded according to HIPAA regulations. Understanding PHI is crucial for anyone working with patient data to ensure privacy and security. Question 9. Which of the following is considered a key component in determining the level of an evaluation and management E/M service when using the 1995/1997 documentation guidelines? A. Time. B. Counseling. C. Coordination of care. D. History. Answer: D. History. This question tests knowledge of E/M coding guidelines prior to the 2021 changes for office/outpatient E/M services, which are still relevant for other E/M categories. The keyword key component refers to the three main elements used to determine E/M levels: history, examination, and medical decision-making. While time, counseling, and coordination of care can influence an E/M level, they are not considered the key components in the same way as history, exam, and medical decision-making under the traditional E/M guidelines. For example, to code a moderate-level E/M service, a physician would need to document a detailed history, a detailed exam, and medical decision-making of moderate complexity. Remember, for most E/M services prior to the 2021 outpatient changes, history, exam, and medical decision-making are the core pillars for level selection. Question 10. A patient is seen for a routine screening colonoscopy due to a family history of colon cancer. What is the appropriate primary ICD-10-CM code? A. Z12.11. B. K63.5. C. Z80.0. D. Z00.00. Answer: A. Z12.11. This question assesses the use of Z codes, specifically for screening encounters. The keywords routine screening colonoscopy and family history of colon cancer are important. While the family history is noted, the primary reason for the encounter is the screening itself. Z12.11 is the correct code for encounter for screening for malignant neoplasm of colon, which represents the primary purpose of the visit. For example, if a patient has a mammogram because they are 45 years old and it's part of their routine checkup, a Z code for screening would be primary, even if a family history of breast cancer is also documented. Remember to prioritize the reason for the encounter. If it's a screening, use a screening Z code first. Question 11. What elements are typically included in the global surgical package according to CPT guidelines? A. Preoperative visits, intraoperative services, and unrelated postoperative visits. B. Preoperative visits, intraoperative services, and routine postoperative care. C. Only the intraoperative services and follow-up care for complications. D. Intraoperative services and all office visits for 1 year following surgery. Answer: B. Preoperative visits, intraoperative services, and routine postoperative care. This question tests understanding of the CPT Global Surgical Package. The keywords Global Surgical Package refer to a bundled payment concept for surgical procedures. The Global Surgical Package typically includes the preoperative visit, 1 day prior to surgery, the surgery itself, intraoperative services, and routine postoperative care for a specific period, e.g., 10 or 90 days, depending on the procedure. For example, if a surgeon performs an appendectomy, the global package usually covers the surgeon's fee for the initial visit, the surgery itself, and any routine follow-up visits related to the appendectomy for a defined period afterward. It's important to know what's included to avoid unbundling and incorrect billing. Question 12. Which of the following data elements is typically collected for hospital inpatient discharges and is a key component of the Uniform Hospital Discharge Dataset, UHDDS? A. Patient's favorite food. B. Date of admission and discharge. C. Number of siblings. D. Patient's pet's name. Answer: B. Date of admission and discharge. This question assesses knowledge of healthcare data sets, specifically the UHDDS. The keyword UHDDS points to a standardized set of data elements for hospital inpatient care. The UHDDS includes core data points essential for accurate billing, epidemiology, and research, such as patient demographics, principal diagnosis, other diagnoses, procedures, and dates of admission and discharge. For instance, collecting the date of admission and discharge is crucial for calculating length of stay and determining reimbursement for inpatient services. Remembering that UHDDS focuses on essential clinical and demographic data for inpatient care helps in identifying its components. Question 13. A patient presents to the ED with injuries sustained in a fall from a cliff during a hiking trip. How would this external cause be primarily coded in ICD-10-CM? A. As a primary diagnosis. B. Using a Z code. C. As an external cause code, V00Y99. D. As a symptom code. Answer: C. As an external cause code, V00Y99. This question tests understanding of external cause codes in ICD-10-CM. The keywords injury sustained in a fall from a cliff clearly describe the circumstances of the injury, not the injury itself. External cause codes, from chapters V00Y99, describe how the injury happened, the intent, e.g., accidental, intentional, the place where the event occurred, and the activity of the patient at the time of the event. For example, if a patient breaks their arm in a car accident, the fracture is coded first, followed by an external cause code describing the motor vehicle accident. Remember, external cause codes provide valuable data about injury epidemiology but are never the primary diagnosis. Question 14. What does the P in the anesthesia physical status modifier P1 P6 indicate? A. Patient's prognosis. B. Patient's age. C. Patient's physical status. D. Patient's primary diagnosis. Answer: C. Patient's physical status. This question assesses knowledge of anesthesia coding, specifically physical status modifiers. The letter P in the P1 P6 modifier specifically denotes the patient's physical status, ranging from P1, normal healthy patient, to P6, brain-dead patient. These modifiers provide important information about the patient's overall health before anesthesia and affect payment for the anesthesia service. For example, an appendectomy on a P1 patient, healthy, would typically involve less risk than the same procedure on a P4 patient, severe systemic disease. Always remember that these P modifiers describe the patient's general health, not the complexity of the surgery itself. Question 15. Which payment system is used by Medicare for most hospital outpatient services? A. Diagnostic-related groups, DRGs. B. Resource-based relative value scale, RVUs. C. Ambulatory payment classifications, APCs. D. Skilled Nursing Facility Prospective Payment System, SNFPPS. Answer: C. Ambulatory Payment Classifications, APCs. This question assesses understanding of Medicare's outpatient reimbursement methodologies. The keyword hospital outpatient services is the key clue. Medicare utilizes ambulatory payment classifications, APCs, to reimburse hospitals for outpatient services, bundling together services similar in clinical content and resource usage. For instance, a patient receiving a routine colonoscopy in an outpatient hospital setting would have the service billed under the APC system. Always distinguish between inpatient, DRGs, and outpatient, APCs, hospital payment systems, as this is a common point of confusion. Question 16. According to ICD-10-CM guidelines, how is a bilateral condition, e.g., bilateral cataracts, generally coded if there are separate codes for left and right? A. Code only the right side. B. Code only the left side. C. Code both the left and right codes. D. Use an unspecified code for bilateral. Answer: C. Code both the left and right codes. This question tests knowledge of ICD-10-CM laterality coding guidelines for bilateral conditions. The scenario involves a bilateral condition, bilateral cataracts, with specific codes available for each side. When separate codes exist for laterality, e.g., right and left, and the condition affects both sides, both the left and right codes should be assigned. For example, if a patient has carpal tunnel syndrome in both wrists, and there are codes for right and left carpal tunnel, both codes should be reported to accurately reflect the patient's condition. Always use the most specific codes available, and if a condition is bilateral and specific codes for each side exist, code both. Question 17. What is the primary purpose of the OIG Work Plan? A. To provide clinical guidelines for patient care. B. To outline areas of focus for healthcare fraud and abuse investigations. C. To set reimbursement rates for Medicare services. D. To establish patient privacy regulations under HIPAA. Answer: B. To outline areas of focus for healthcare fraud and abuse investigations. This question assesses knowledge of healthcare compliance, specifically the role of the Office of Inspector General, OIG. The keyword OIG Work Plan refers to an annual document published by the OIG. The OIG Work Plan details the OIG's audit and enforcement priorities for the upcoming year, highlighting specific areas of concern regarding potential fraud, waste, and abuse in federal healthcare programs. For instance, the work plan might identify specific billing practices for certain services as areas that will be audited for compliance. Healthcare providers should review the OIG Work Plan annually to understand potential compliance risks and adjust their practices accordingly. Question 18. When coding for a radiological examination that includes both the professional and technical components, which modifier is typically used if only the professional component is being billed by the radiologist? A. TC. B. -26. C. RT. D. LT. Answer: B. -26. This question tests understanding of CPT modifiers for radiology services. The keywords professional component and radiologist indicate that only the physician's interpretation and report are being billed, not the use of the equipment or the technician's services. Modifier -26 is appended to a CPT code to indicate that only the professional component of a service, e.g., a radiology interpretation, is being reported. For example, if a radiologist interprets an X-ray performed at an outpatient imaging center, the radiologist would bill the CPT code for the X-ray with modifier -26, while the imaging center would bill the same CPT code with modifier TC for the technical component. Remember, -26 is for the doctor's brainpower, TC is for the machine and staff. Question 19. What does the suffix ectomy signify in medical terminology? A. Surgical repair. B. Surgical incision. C. Surgical removal. D. Surgical creation of an opening. Answer: C. Surgical removal. This question assesses knowledge of common medical suffixes. The suffix ectomy consistently indicates the surgical removal of an organ or part of the body. For example, an appendectomy is the surgical removal of the appendix, and a tonsillectomy is the surgical removal of the tonsils. Understanding these common suffixes can help decode many medical terms, which is fundamental for accurate coding. Question 20. A patient is admitted to the hospital with sepsis due to a Staphylococcus aureus infection, with an associated acute renal failure. What is the correct sequencing of the primary diagnosis for this case in ICD-10-CM? A. Acute renal failure, then sepsis, then Staphylococcus aureus. B. Sepsis, then Staphylococcus aureus, then acute renal failure. C. Staphylococcus aureus, then sepsis, then acute renal failure. D. Sepsis, then acute renal failure, then Staphylococcus aureus. Answer: D. Sepsis, then acute renal failure, then Staphylococcus aureus. This question tests understanding of ICD-10-CM sequencing guidelines for sepsis. The presence of sepsis with an associated acute organ dysfunction, acute renal failure, is key. The sequencing rule for sepsis with associated acute organ dysfunction states that the code for the underlying systemic infection, sepsis, should be sequenced first, followed by the code for the acute organ dysfunction, and then the code for the specific organism if known. For example, if a patient has sepsis due to pneumonia with septic shock, the sepsis code is primary, followed by the septic shock code, and then the pneumonia code. Always follow the specific sepsis guidelines in the ICD-10-CM manual, as they dictate precise sequencing. Question 21. A physician documents that medical decision-making, MDM, for an office visit was of high complexity. Which of the following elements would typically support this level of MDM? A. Self-limited or minor problem. B. Stable chronic illness. C. New problem, no additional workup planned. D. Management of at least one chronic illness with exacerbation or side effects of treatment. Answer: D. Management of at least one chronic illness with exacerbation or side effects of treatment. This question assesses understanding of medical decision-making, MDM, components for E/M coding, particularly under the 2021 E/M guidelines for office/outpatient visits. The keyword high-complexity MDM implies significant risk, a high number of diagnoses/management options, and a high amount of data to be reviewed. Managing a chronic illness with an exacerbation or side effects of treatment demonstrates high complexity due to the increased risk of morbidity/mortality and the complexity of management. For example, a patient with brittle diabetes experiencing severe hyperglycemia requiring medication adjustments and potential hospitalization represents high-complexity MDM. Remember that high-complexity MDM requires significant thought, management, and risk, usually involving worsening conditions or serious treatment considerations. Question 22. What is the primary purpose of the False Claims Act, FCA? A. To protect patient privacy. B. To prevent and detect healthcare fraud against federal government programs. C. To regulate drug prices. D. To establish licensing for healthcare providers. Answer: B. To prevent and detect healthcare fraud against federal government programs. This question assesses knowledge of the False Claims Act, FCA. The keywords False Claims Act relate directly to fraud detection. The FCA is a federal law that imposes liability on persons and companies who defraud governmental programs, most notably Medicare and Medicaid, by submitting false or fraudulent claims for payment. For example, if a clinic knowingly bills Medicare for services that were never performed, they could be penalized under the False Claims Act. Understanding the FCA is crucial for coders to ensure accurate and compliant billing practices that protect government funds. Question 23. A patient is admitted for intractable epilepsy. What is the correct ICD-10-CM code? A. G40.309 B. G40.A09 C. G40.409 D. G40.509 Answer B. G40.A09. This question tests understanding of specific disease coding within ICD-10-CM, particularly neurological conditions. The keyword intractable epilepsy is crucial. While all options are for epilepsy, G40.A09 specifically identifies intractable epilepsy with status epilepticus, unspecified. It's essential to look up the specific type of epilepsy, intractable, to select the correct subcategory. For example, simply coding epilepsy, G40.909, would not capture the severity of intractable epilepsy. Always ensure you capture the full specificity of the diagnosis, including severity, control, and presence of status epilepticus, when coding neurological conditions like epilepsy. Question 24. A chemistry panel consisting of a comprehensive metabolic panel and a lipid panel is performed. How should these be coded using CPT? A. Code each individual test component separately. B. Code each panel separately. C. Code only the comprehensive metabolic panel. D. Code only the lipid panel. Answer B. Code each panel separately. This question assesses knowledge of CPT coding for pathology and laboratory services, specifically panel codes. The keywords comprehensive metabolic panel and lipid panel indicate two distinct CPT panel codes. When multiple CPT-defined panels are performed, each panel should be reported with its corresponding CPT code, as long as all tests included in each panel are performed. For example, if a physician orders both a basic metabolic panel and a hepatic function panel, both CPT codes for these panels would be reported. Remember, if a CPT code defines a panel, all components within that panel must be performed to use the panel code, otherwise, individual tests are reported. Question 25. What do relative value units, RVUs, represent in the Medicare physician fee schedule? A. The total cost of a service to the patient. B. The relative value of a service based on physician work, practice expense, and malpractice insurance. C. The number of times a service can be billed in a year. D. The quality of care provided during a service. Answer B. The relative value of a service based on physician work, practice expense, and malpractice insurance. This question assesses knowledge of the Resource-Based Relative Value Scale, RBRVS, which is how Medicare pays physicians. The keyword RVUs directly refers to the components of this payment system. RVUs are a standardized measure of the value of a service, comprising three components: physician work, effort, skill, practice expense, overhead, and malpractice insurance. For example, a complex surgical procedure will have a higher RVU value than a brief office visit because it requires more physician work, resources, and carries higher malpractice risk. Understanding RVUs helps coders appreciate how their accurately coded services translate into physician reimbursement. Question 26. A patient is admitted for pneumonia. During the hospitalization, the patient develops urosepsis. What is the correct sequencing of diagnoses for this encounter? A. Urosepsis, then pneumonia. B. Pneumonia, then urosepsis. C. Both codes equally, order doesn't matter. D. Only pneumonia, as it was the reason for admission. Answer B. Pneumonia, then urosepsis. This question tests understanding of coding complications and sequencing principles in ICD-10-CM. The keyword develops urosepsis indicates a new condition arising during the hospital stay, which is a complication. Generally, if a condition that was present on admission progresses, or if a new complication arises during the stay, the principal diagnosis, the condition chiefly responsible for the admission, remains primary, and the complication is listed as a secondary diagnosis. For example, if a patient is admitted for a fractured hip and then develops hospital-acquired pneumonia, the fractured hip remains the principal diagnosis, and the pneumonia is a secondary diagnosis. Always prioritize the condition that led to the patient's admission as the principal diagnosis. Question 27. What is upcoding in medical billing? A. Billing for services that were not performed. B. Billing for a service at a higher level than what was actually provided or documented. C. Billing for a service at a lower level than what was actually provided or documented. D. Billing for a service twice. Answer: B. Billing for a service at a higher level than what was actually provided or documented. This question assesses knowledge of common billing compliance issues, specifically upcoding. The term upcoding refers to the practice of assigning an inaccurate CPT or ICD-10-CM code to increase reimbursement, often by billing for a more complex or expensive service than what was actually performed or supported by documentation. For example, billing a Level 4 E/M service when the documentation only supports a Level 3 would be considered upcoding. Upcoding is a form of fraud and abuse, leading to significant penalties, so coders must ensure the code selected always accurately reflects the documented service. Question 28. A 5-year-old child receives a routine MMR, measles, mumps, and rubella vaccine during a well-child visit. Which CPT code category would be used to report the vaccine administration? A. Surgery. B. Medicine. C. Radiology. D. Anesthesia. Answer: B. Medicine. This question tests knowledge of CPT code book sections and their content. The keyword vaccine administration points directly to the CPT medicine section. Immunizations, including vaccine administrations, are typically found within the medicine section of the CPT manual, codes 90,281 to 99,607, not in surgery, radiology, or anesthesia sections. For example, when coding for a tetanus shot, you would look in the medicine section for both the vaccine product and its administration. Remember that the medicine section covers a wide range of non-surgical services, including immunizations, injections, and various therapeutic procedures. Question 29. What directional term describes a structure located closer to the midline of the body? A. Lateral. B. Distal. C. Medial. D. Proximal. Answer: C. Medial. This question assesses understanding of fundamental anatomical directional terms. The keyword closer to the midline directly defines the term medial. Medial refers to a position or structure that is nearer to the imaginary vertical line that divides the body into equal left and right halves. For instance, the nose is medial to the eyes, and the sternum, breastbone, is medial to the shoulders. Understanding these directional terms is crucial for accurately interpreting and documenting anatomical locations in medical records. Question 30. A patient presents with a laceration to the right forearm. The documentation indicates that the wound was closed with sutures. In ICD-10-CM, how would the site of the laceration be specified? A. Forearm, right, unspecified part. B. Forearm, right, level unspecified. C. Forearm, right, detailed as either lower, middle, or upper third. D. Forearm, right, with specific muscle involvement. Answer: C. Forearm, right, detailed as either lower, middle, or upper third. This question tests understanding of ICD-10-CM injury coding specificity, particularly for anatomical sites. The key information is laceration to the right forearm and the need for specificity. For injuries to limbs, ICD-10-CM often requires specification of the third of the limb, e.g., upper, middle, lower, to achieve the highest level of detail. For example, a laceration to the distal forearm might be coded as a laceration to the lower third of the forearm, requiring a more precise code than just unspecified forearm. Always strive for the most granular anatomical detail when coding injuries to ensure accurate representation of the injury site.